Welcome. My name is Peter Strong. I'm a professional mindfulness-based psychotherapist, and I offer therapy on Skype for the treatment of anxiety and depression without medications. During these Skype therapy sessions, I will be teaching you how to apply mindfulness for overcoming anxiety and depression, or emotional trauma, or general stress, or any other emotional, psychological condition that is affecting the quality of your life. So being able to do therapy on Skype is very convenient. It's also very effective too, because Skype allows you to see each other, which means that the quality of communication will be much, much higher than other forms of online therapy using email or some form of chat format. You really need to see each other to get full benefit from online therapy. So I have developed this system of working with difficult emotions, such as anxiety and depression, or PTSD and emotional trauma. I also work a lot with people suffering from OCD and intrusive thoughts or intrusive memories or imagery. And I've developed a system called Mindfulness Therapy, which really works extremely well online and is very, very effective for giving you practical methods for overcoming your emotional suffering. So I will be teaching you how to apply mindfulness to work with your emotions during our sessions. I'll be giving you the tools that you can practice yourself between sessions, and that's very important. You want something other than a treatment-based approach like medications, because they don't teach you anything about how to work with your mind, and usually treatments are not really effective in the long run. You need to learn how to work with your emotions more effectively. The common problem that I run into is that people run away from their emotional pain when we need to be embracing it very consciously or mindfully. People hate their emotions that cause pain. They develop a great deal of internal reactivity towards their anxiety or depression, which simply feeds the anxiety or depression. So a very important principle here to understand is that if you want to recover from chronic anxiety or chronic depression, then you must overcome those habitual patterns of avoidance and aversion. So addiction is an example of an avoidance strategy, trying to escape emotional pain. It doesn't work. Sometimes even just talk therapy itself can be a problem, because it's not really addressing the underlying process that's going on that causes your anxiety or depression. It's just talking about your emotions. That's not the same as working with them in a very conscious or mindful way. So in mindfulness therapy, we spend much less time talking about our emotions and much more time on changing the way that we relate to painful emotions or trauma. We need to develop this internal relationship based on direct conscious awareness and a quality of compassion or inner friendliness or kindness towards those emotions. We need to see those emotions as not being your identity, but being objects that arise in the mind due to conditioning. They're basically habits. Emotional suffering is produced by blind, conditioned habits that become reactive. Habits require the absence of consciousness to operate. So bringing conscious attention to your habits and learning to stay present with your habits without becoming identified with them and without getting caught in patterns of reactivity to those painful emotions is essential for change. And that's the primary focus in mindfulness therapy. It's learning to be able to sit with your emotions without identifying with them, without reacting, where you can start to then develop compassion towards those emotions to help them heal. If you react to your emotions in any way, through avoidance, aversion, or grasping, as in the case of addiction, then you will simply feed those emotions. They will not heal if you react. Reactivity inhibits the healing process. But if you establish a relationship that is non-reactive, based on mindfulness, that means based on conscious presence and compassion, then those emotions will most definitely start healing. So this is really, really important. There are other aspects to mindfulness therapy that I have developed to help this healing process. One of which is working with the imagery of the emotions themselves. So with traumatic emotions or traumatic memories, such as occur in PTSD, the primary issue is the emotional imagery itself, the imagery of the trauma or the imagery that is triggered by the trauma. And the quality of that imagery is what actually creates the fear or anxiety or suffering, whatever form that emotional trauma takes. It's the imagery that's key. So uncovering this imagery, looking at its structure, is very much a part of mindfulness work as I teach it. When we see the details of that imagery, we can begin to change the imagery. And when you change the imagery of a traumatic memory, for example, that helps that memory resolve itself so it no longer triggers painful emotional suffering. So working with imagery is really important because imagery is really central to emotions. It's the internal structure of emotions. The external structure of emotions is really based around patterns of reactive thinking and reactive beliefs and so on, and other forms of emotional reactivity to the emotion. And often these are not seen. They happen without our awareness, but they have the same effect as all reactivity, which is simply to prevent healing and to feed the emotional suffering. So uncovering the outer structure, the thoughts and the rumination, the patterns of reactive thinking that feed the emotions is very important and very much a part of the mindfulness approach. Our main mission is to awaken to those thoughts. It's not to try and convince ourselves not to have those thoughts, because that simply is another form of reactivity that feeds the problem, which is reactive thinking. We need instead to break the habitual identification with those thoughts. So we see the thoughts in the same way as objects in the mind, instead of becoming lost in those thoughts. Because when you lose that objective consciousness, then the thoughts take over and they propagate and feed the emotion underneath. So working skillfully with thoughts, essentially breaking free from identification with thoughts, seeing them as objects, is central to working with that outer layer of the structure of emotions. So if you'd like to learn more about the mindfulness approach that I teach, then please do go to my website, and please email me if you have any questions about how this approach can help you. And if you would like to schedule some Skype therapy sessions with me, then we can do so. Please let me know what times work for you, and then we can find a time that works and get started with this approach. People really enjoy the greater ease that comes with therapy on Skype as compared to therapy in person. It's much less intimidating, much less clinical. This is not a medical treatment approach. This is an approach of helping you learn how to work with your emotions more skillfully, using the well-tested methods of mindfulness therapy. So if you'd like to learn more and schedule therapy on Skype with me, then please send me an email. Thank you.